Okay, good morning, everyone. Good morning, everyone. Yes. Welcome to this session on climate health solutions that drive change. And the nice thing about this session is two things. One, it's sponsored by the Geneva Health Forum, which is already an example of collaboration and action from multiple agencies coming together to use their resources, use their know-how, and to be able to bring us all together. And today's session, I'll warn you now, you won't just be sitting and listening. Today's going to be an action session. We're going to start with something. I'm Steve. I forgot that. I'm Steve, and I'm the General Director at Doctors Without Borders, Médecins Sans Frontières here in Geneva. And this is a subject that's very close to our hearts and to our strategic plan. Planetary health is a key ingredient, and we are piloting different projects and also struggling with some of the same challenges. How do we take those interesting pilots and scale them across the organization? How do we change our culture to build in this planetary health lens into everything we do? And at the same time, how do we become a more responsible health actor in reducing our carbon, reducing our waste, better treating our medical waste, et cetera? So very pleased to be here with you today, and I hope we're going to learn some things to take away. And we have some MSFers in the audience that that will be their job. Right, Amr? Perfect. So here's what we're going to do for the agenda today. We're going to have hopefully 2 lightning rounds where we're going to get inspired by a couple of very smart people that are going to do a little presentation, 5 minutes max, really to get our juices going. We have Tarani Shoje, who's here with us, thank goodness, and she's going to lead off from the WHO. And Benoit Mirabel, who's also here, so that's also good news, from One Sustainable Health for All Foundation. So those are going to be 5 minutes each, and that's going to be followed by collaborative challenge rounds, where we're going to have 3 different challenges, one centered around data, one centered around carbon reduction, and one centered around how are we really scaling that impact and change within health systems. So that'll be very interesting. Each of those collaborative challenge rounds will last 15 minutes. There are going to be places set up at the back that aren't yet, but they will be by the time we get there. And you will be led by 3 people who will also introduce. They will put out their issues, what they're working on, and the challenges that they're having. And what we're really hoping is that from the audience members, you'll have ideas, solutions, links, other things that can feed into that dialogue. And then we'll have a QR code that we're going to show where you can actually scan, jump in, and we want you to put in your commitments. If you say, hey, I know somebody you should know, we don't want that just to sit on the floor. We want it to go into the database as a commitment. So when you leave here, you not only participated and learned, but you're part of this collaborative action that's going to help us scale health impact in climate change. And then each of those 3 panels, you don't choose which one you're going to go to. You're going to go to each one. There'll be 15 minutes each, and then we'll rotate and then rotate. And sign up on our commitment tree. And then we'll have a nice little coffee session, which we hope you'll stay for, to be able to expand on those networks, but also on some of the discussions and dialogues and commitments that you've all made. And that's me again. I'm Steve. No, we did that one. Let's go the other way. Okay, so we're going to start with the first lightning round. Tarani Shojai from the WHO, and I'm very pleased to welcome her, and please give her a nice welcome so she can get going.
So thank you very much. I want to thank the GHF team, Eric Comte, Jessica, and also the Climate Change Health Unit in WHO, on behalf of whom I will speak about the crucial issue, which is scaling up climate health impacts. I think it's a very huge question, a complex and an urgent question. So the good news today is the weather is very good. So we are going to do it very well. And then No, it's not good, this one, the other side. Yeah. Yeah, just a key point, very crucial. The IPCC report, the last report, reported that 3.6 billion people are living in area highly susceptible to climate change. It's about the half of the humanity. The other point is that the mortality and also the death raised from different heat waves is now in the past decade 15 times higher than in vulnerable regions than in other regions. The question is a question of the equity. We know that low-income countries and small islands are less involved in the gas emission, but they are paying a very important and highest contributions to the climate change impacts. So, action is needed now. What is happening, not only what is coming. And I think two questions is how we can articulate field actions from countries to a global strategy, which could be, and which is, and because I will present you the global plan of action of WHO. And so I think it's a very crucial action. It's a very crucial question, how to articulate field actions with the global strategy. And in urgency, how to respond and how to riposte in terms of urgency. Just to have a look, I don't be very, I will be very quick. I think you know it very well, but just in terms of the health impacts of the climate change, we know that climate change impacts health in a myriad of ways. It could be directly by the raising of mortality or morbidity from heat waves, extreme weather events, air pollution, but also indirectly by increasing the rate of vector-borne disease, waterborne disease, water scarcity, and reduced food production, and also mental health and psychological impacts of the climate change. Another thing is that the burden of climate change health impacts is also in social determinants, and it undermines the social determinants of health, access to health, as well as access to wellness and to good services of health. So what WHO does regarding these different areas, how we address the wide range of the health impacts of climate change, for example, for the air pollution, reducing the air pollution, how we can do it. I think a concrete example could be assessing the vulnerability indicators and analyzing vulnerability indicators. So it means having good system of surveillance, and not only surveillance, it's also to have a good system to response to the urgency. And another thing, promoting co-benefits by reducing gas emission, both we reduce health impacts, but also we act in another area, and I think it's how to destroy the bridge between different sectors by reducing only the gas emission. And of course, strengthening health systems and decarbonizing health systems and climate resilience in health system, because we know that health systems are responsible for 5% of gas emission. So having a quick look to the global WHO plan of action on climate change, 2024-5-28, so for 3 years. The good news that it was related by the adopted resolution last year in WHA, the resolution on climate change and health, calling members to scale up their efforts to respond to climate change. And so the resolution calls for a global action plan aligned with the UNFCCC Paris Agreement and the program of work of WHO. So I think the good news, we have 2 good news. We have a resolution on climate change and health. The second news is there is a plan, there is a global plan. And so it means, and it highlights the importance of the concrete actions regarding a resolution. In terms of process, so you can see in this figure, it took less than 1 year between 15th of July and so May now. The global action will be discussed next week, 26, at the General Assembly. And we hope it will be adopted by member states. You see different consultations points. So the consultation was very, very broad with member states, of course, but also with civil society, with foundations, as well as the different levels of WHO, because in our mind, it should be built regarding what is happening in the field. So the 3 levels of WHO, so the HQ, regional and country offices were consulted many times to discuss about this global plan. So what are the strategic areas? I think to be very 3 points. Interesting, important, but very crucial: leadership, coordination, advocacy. So it could be a little bit, we can put everything on it. But I think in terms of to be more, to get to the details, you have the access in the site in the website WHO. But I would just underline the fact that for leadership, coordination, advocacy, it's to promote climate change and health impacts in the climate agenda. It's to destroy the bridge between climate change discussions and health discussions. It's also, it's the global target, and the objective is to empowering communities as well as giving good examples of success story. The other point is the evidence and monitoring, and I think it's also a crucial thing. It's related to research, to having a research agenda, to shaping a research agenda, good data regarding health impacts. And so it's to having a good tool for action regarding research and the bridge between research and policy. The third one is country level action and capacity building. And I think it's also the core of the strategic, of one of the strategic areas, which is related to the promotion of mitigation and adaptation in the field. So in countries, country support, addressing health in different agenda, climate agenda in countries, as well as vice versa. So putting climate in health agenda, and because sometimes it's not two ways, and it's done only on one way and not on the other ways. So just to give you a look to an example to action area leadership coordination advocacy, you can see we have a global target, we have a different objective A, B, C, D, and something which is interesting, it's the fact that we propose actions for member states, for WHO Secretariat, as well as for stakeholders. That means that for each objective, there is expectation and there is a guideline for member states, WHO Secretariat, as well as stakeholders. So what are the next steps for implementation? So yes, we hope it will be adopted next week, 26. The next step should be the implementation. And for the implementation, we talk also about monitoring. What I can say is the central role of WHO to provide technical assistance, supporting member states, coordinating with the stakeholders regarding this global plan of action. And in terms of guidance, we are setting a steering committee group which oversees the implementation and ensuring alignment with the global health and climate goals. The steering committee includes many representatives from the three levels of WHO, so HQ, regional, and country offices, and ensure to have connections with other stakeholders, civil society, and private sector, or every stakeholders. Indicators will be developed, aligned to different UNFCCC indicators and other SDGs. And just to finish, and I think I don't know if it's 5 minutes. I'm not sure. They told me 10 minutes. And then, so just to finish in a positive, very positive note, because the sun is there today. And so what are some successful examples of collaboration? I think we will have examples from different colleagues here. And I would just mention the intervention for I don't remember how we call it, what's the meaning? the roundable, with Attach, with my colleague Elena Villabos for talking about Attach. So I thank you, and and we are available with Elena and other colleagues. We are available for discussions in break coffee. Thank you.
So thank you so much for setting the scene. It was again my error. This was not the lightning round, as you probably saw. These are setting the scene of where we're going. And thank you so much for setting out the roadmap, because without a roadmap, we don't know where we're going, and that we can then hang our hat on, and that will come into our other discussions. And if you want to get in touch, there's the address. So please get in touch directly. And then we'll welcome, not for a lightning round, but for another scene setting, Benoit Mirabel from the One Sustainable Health for All Foundation. Benoit.
Thank you for the introduction. And following what was said by our friend from MSF and WHO, I've been asked to explain an initiative that was launched during the pandemic. And it is about one sustainable health. And one of the main issues, because it came from various scientists, professionals. It was about bringing together what we used to call the different families. And the climate professional families was not quite the same of the health professional families, and having open discussion between professionals about the issues. This was one of the initial commitments. So today we are here to discuss about why do we need to scale up our impact and how. And I will say that we know that we work from science to society and vice versa. Society also with science. And it's very important, especially today, because we need to accelerate right locally in the field. And sometimes the theory that we could have is not appropriated. And this is why we have this, this discussion, open discussion. But science is key, as we all know, and we need to all defend it, especially these days in our society. So I've been asked to give you some information about this forum. So rapidly, we have 10 international working groups, and the foundation is a tool to support this forum made by the professional. At the end of the day, it started by informal discussion. We were thinking about having a tool to support and to formalize the discussion. And thanks to the Geneva Health Forum and the World Health Summit in Berlin, we were able together to organize it. So we after 2 years, because all the professionals are committed in other activities, and so they take time and to share about their knowledge, and especially, as I said previously, about climate and health issues. Because, if you have been some years ago in the COP, it was my case, it was a very little space for health. It started in the Club Glasgow. We had the pavilion WHO, and now it's going to expand, which is, I think, important, as it was also explained by WHO. So I will not go too much in the details with respect to the timing and the agenda today, but just to give you information about it. And we have, by the way, you see the International Working Group 9. It is about One Health in humanitarian setting. And we have Isabelle, Raphael from the Geneva University leading, co-chairing this International Working Group with an NGO in Belgium, Humanity Inclusion. And they recently released a policy brief with concrete operational issues. So the scientific council, because we need, of course, to drive from science to society to operation. You have a view of the scientific council, and we have more than 150 organizations worldwide committed because they endorse the recommendation. On one side, we have the international working groups, where the experts speak freely, and then on the other side, we have the organization formally who endorse it or not by giving the support with their logo. And this is a process we started. But it's also the occasion to have an annual meeting. The first one was 2 years ago in Lyon. And at the closing, Professor Awa Marie Kolsek, former state minister of Senegal, said, next year, I propose you come to Dakar. But it will not be OSH for all. It will be OSH by all. Very interesting. So we went to Dakar, and we will be back in November for this annual meeting of the forum with all our partners, our friends. And we have learned yesterday during his speech, Emmanuel Macron said that he will organize also a One Health Summit with government in Lyon at the same time. So it will be an occasion between private and public together, you know. So we focus, and we have the support of different partners, but we focus together on health, environmental, and social, because as we know, if we want to succeed with climate and health issues, we need also the social, the adaptation of the society. I remember 25 years ago, I was with Action Against Hunger, and we've seen the first people leaving their land due to the climate issues. They were forced to move to big cities, okay? At that time, 25 years ago, we did not have so much obesity. And 2/3 of the obesity now is in developing countries. And it was not the case before. And the science explain us also that one of the impact also of these people moving from rural area to cities and changing the way they drink and their food have an influence on their body, and with, you know, obesity increasing also. So it's just an example. We have many examples, and this is a transition, but with what is going to follow about having clear example. But please note that you are welcome. So, you know, this is an international collaborative initiative. It is open, and we will launch the OSH factory. Why OSH? Because the scientists and the professionals decided to put together One Health, planetary health, and the SDGs together in the pot and to make it cook, and we will see the recommendation. So thank you. This is the partners for the moment. And you have the website, and the Geneva Health Forum, of course, is a strong partner since the beginning of this initiative. Thank you.
So thank you very much, Benoit, for presenting us the new USH factory, and hope to really benefit from that collaboration. We've seen over the years the difficulty in bringing these different parts together from One Health to planetary health, making the link now through WHO into the COP climate targets, which were dominated really by technical discussions on gigatons of carbon, and all of that's necessary, but it also doesn't drive home the link and really show that the climate crisis is a human health crisis first and foremost. And so many people are working on that, and I look forward to the great results. So now we will go to the lightning rounds with two different speakers who are really going to challenge our imaginations and set the stage for the collaborative working groups to come. And there's a whole lot of names there, not two. So I think we're going to go with the top two. I think that's the best way to go. All 4 lightning rounds. I'm really upside down. So we have 4 lightning rounds, which means we're going to have even more things to talk about. And you can see all of our speakers here. We're going to go in order. But we have Sarah Imbach from Vétérinaires Sans Frontières, Monica Wasuna from DNDi, Digital Twins for Watershed-Based Approach, and that's Jean-Claude. And then we're going to finish up with Unitaid's Carbon Smart Health Products with Lourdes Sanchez. So we'd start, and please help us welcome Sarah Imbach.
Good morning, everyone. I would like to take you just very briefly to the Horn of Africa, where pastoralist and agropastoralist communities are facing a convergence of climate and health crisis. Oh, there we go. So communities in the arid and semi-arid lands have traditionally relied heavily on mobile livestock production for both food and income. But the ecosystems that underpin these livelihoods are under increasing stress. Unsustainable land use are degrading the rangelands, and climate change is driving more frequent droughts and floods. I've been working on this for 10 years now, and at this point, it just seems relentless. It does not stop. And alongside others, these pressures really impede, disrupt, and sometimes completely devastate livestock production. And the result is rising food and nutrition insecurity, displacement, and greater risk of disease outbreaks. At the same time, remote pastoralist and agropastoralist communities often have inadequate access to basic services, including healthcare and veterinary care for their herds. Their traditional mechanisms to cope with crisis are overstretched, and alternative livelihood options remain scarce. Our response to these interlinked challenges is grounded in the One Health approach. We've heard about it now, and this is now really what we can do on the ground. It's guided by its 4 C's. That's communication, coordination, collaboration, and capacity building across the different health sectors. And we do not only understand this as human and veterinary health, but also environmental health. And the centerpiece of our project is the One Health units that bring together under one figurative roof the different health sectors and their service providers. The One Health units are shaped by communities according to their needs, and they're overseen by local governments through dedicated collaboration platforms. You can see this in this now very big visual here, where the bulky multi-stakeholder innovation platform stands for the community mechanism, and the One Health Task Force stands for the government oversight bodies. But these One Health units are not something parallel. They are really grounded and based on the existing community-based public and private health systems and the service providers that are already active in there. But what is new is that they are designed to deliver really integrated human, animal, and environmental health services. In the environmental domain, our partner, the International Livestock Research Institute, ILRI, is currently piloting community rangeland health workers as an innovative approach to bridge the gap between frontline service delivery and natural resource management. In parallel, and based on these many challenges that I mentioned at the beginning, we also provide support to communities to diversify and climate-proof their livelihoods. And this can range from agro-silvopasture, where we promote the planting and use of fodder and fruit trees, over hydroponic fodder production and livestock feed production, to improved milk processing and marketing, poultry, you name it. In this, we work with pastoralist and farmer field schools. That's an old approach, but it really works to engage people to hands-on experiment and see what works for them. And finally, our human health partner, Amref Health Africa, is working with communities to establish weather observation networks that help them track climate and weather patterns and better prepare for droughts and floods. So with our One Health units, we are already reaching over 150,000 people across Ethiopia, Kenya, and Somalia. That doesn't sound like much maybe to some of you, but we're a small organization. It's a lot for us. And what started as a pilot in 2019 is now really becoming a proof of concept. The model is fully developed, the key actors are engaged, and it's really being implemented on the ground. We have also published our standing operating procedures and our training materials so that they can be adopted and adapted by others. So right now our focus is on strengthening the mentioned components, but also on sustainable financing mechanisms always, and on really generating more evidence on cost effectiveness and health outcomes. And I think that's also this intersection between science and society and back and forth. And our goal is really to support the institutionalization of these One Health units as a viable and sustainable approach. With strong community ownership and government buy-in, we believe that our model has the potential to scale much beyond our reach and to really make a meaningful impact and contribution to resilient health systems in remote, underserved, and fragile pastoralist and agropastoralist areas. Thank you.
And now we're going to move on to our next speaker from the Drugs for Neglected Disease Initiative, Monica Wasuna.
Thank you very much for inviting us to be a part of this great discussion. I am going to talk to you about climate-sensitive diseases using neglected tropical diseases as an example, and zero in into leishmaniasis, because that is the passion of my life as well. So what is the problem? The problem here is that we have these diseases called neglected tropical diseases, and there are a group of 21 of them as classified by the World Health Organization. The NTDs, which I will refer to them as NTDs, they affect more than 1 billion people globally, and mostly in the least developed economies, and very impoverished communities. And they live in cycles of poverty, disease and poverty all the time. And some of them of the NTDs are climate sensitive. I will use an example of leishmaniasis. Leishmaniasis, there are 3 different forms of leishmaniasis. There's the visceral form that affects the internal organs of the body, the liver, the spleen, bone marrow. And then there is the cutaneous form, which affects the skin. And then you have the mucocutaneous, which affects the mouth. But of the three types of leishmaniasis, the visceral form is the deadliest, and it kills. If you're not treated, 95% of the patients really die. And half of these patients are children. So modeling studies have shown that climate might affect the length of transmission seasons, because leishmaniasis is transmitted in seasons. In dry, you have to wet season and dry season, so it's sensitive to that. So with the changing climate, transmission also is likely to change, and distribution of vectors also is going to change, and the reservoirs, of course, are going to change, and therefore new cases will go up. Also, this disease, leishmaniasis, affects the pastoralists and the people who keep on moving for greener pastures for their animals. And you find that with changing weather and movement of these people, this increased disease transmission and risk of outbreaks. In my own country, in Kenya, we've had so many outbreaks recently because of change of weather. There have been flooding and things like that. And Kenya has 47 counties. And over the years, there were only 6 counties that had leishmaniasis, were endemic of leishmaniasis. Now, there are 11 and going up. So the problem is getting bigger. So what is my institution doing and our partners, what are we doing to be able to solve this? For the last so many years, maybe 80 plus, the treatments for visual leishmaniasis have largely been injectable, they are toxic, difficult to use, variable efficacy. You need to be in hospital to be treated. There has to be a cold chain. Imagine you're poor, but where will you get these fridges to keep these treatments? And the treatments are expensive. So what are we doing? What is the solution? So we are contributing to sustainable elimination of visual leishmaniasis. That is key. We need to eliminate this disease. And so we are trying to develop, and we have developed cheaper, shorter, and more effective combination treatments for leishmaniasis in Africa. And also in other countries, there has been adoption of new visceral leishmaniasis treatments of short duration in India and Bangladesh, Nepal, and so on. But the ideal is the oral treatment. Imagine if we had oral treatments, which we are, with our partners, are developing now. You can just tell someone, go take these 2 medicines at night, or 2 in the morning, 2 in the evening at home for 10 days. That is the ideal, and that's what we are trying to do. So if you take nothing from here, it's important that innovation is key. Innovation of health tools is really key. That's the vaccines, diagnostics, and treatments for these climate-sensitive diseases. And adoption by countries will be core to dealing with the climate change strategies. So it's best that we have the treatments that we reduce the time for these treatments, and they are more adapted to whatever is happening. Yeah, so we really need to work towards elimination. So in conclusion, I just want to say that the talk of leishmaniasis is all over. It's a global problem, and it's been associated with climate change. In Kenya, you see there are many outbreaks. In Somalia, in Pakistan, in Thailand, and even in Europe, the problem is increasing. So let us work together. Let us combine our efforts. Let's nobody, no institution, no organization, nobody alone can deal with this. It has to be a concerted effort if we have to eliminate entities. Thank you very much.
Okay, and now we will move on to our next presenter, Jean-Claude Baraka Munyaka from the Swiss Federal Institute of Technology.
Good morning. So today I'm going to present to you a project that we're currently working on. So it's an ongoing project. We just completed last year the exploration phase. So we are working in collaboration with us. I'm representing APFL, but we're working with the UMCSP, which is based in Morocco. Our implementing partner is the Red Cross DRC. So we are working in Kinshasa, and maybe some of you knows how big the city is and how growing the city has been lately. 3 weeks ago, talking about we because I'm also from Congo, so they had flooding event that cost the life of about 70 people. And so there is a growing climate change impact in that particular city. So during our exploration phase, we went in the field and we conducted some focus group discussion, and we also did some survey. So some of the challenges came up, and among them, we actually discovered that the country hasn't really invested much in infrastructure. So with this growing impact of climate change, obviously the infrastructure that is currently in the country is not appropriate to that. So regarding the health challenge, we also identified some of them. So just to give the context of the Red Cross and their operation. So at the moment they have, I think about 60,000 volunteers that their job is basically to react every time there is either a man-made or a natural disaster. So every time there is a flooding, the Red Cross volunteers, they are the one that goes to the fields and they're the one that basically help the vulnerable population. So obviously for them, they came to us because they want a solution so that they will know exactly how to deploy their volunteer and when to deploy them. Or obviously also there's also this aspect of resources. So how many resources do we make available for the volunteer to be able to help the vulnerable population? So so to basically assist on that, I'll apologize. I'm gonna have to move around slides. Basically, to be able to assist on that, so we came up with this tool that is already available elsewhere. There are many countries that have developed this digital twin. So for us, the idea is to basically deploy the digital twin to try to contextualize a digital twin in the context of Congo. So how to do that? We basically work in a small area where the Red Cross is already very well implanted. So these two areas in Maziba and Dingi is in the municipality of Matete. Matete is basically a municipality that is between Njili and the river. So Njili River is basically one of the very powerful river that goes to the Congo main river. So we ran some hydrological modeling in that particular area. So as you can see in Maziba, so about 50% of this particular area is vulnerable to flooding. And so there is also a small area next to it, Dingi. This area, there's about 25%. So if you combine both, we're talking about 7,000 households that are constantly at risk of being flooded. So for the Red Cross, their job basically to deploy as fast as possible their volunteers in those areas so that they can assist. So our digital twin, I'm not sure if I'm able to go back. Our digital twin, basically what we are currently doing is to basically try to create a virtual reality of the ground, but we are looking at it in a hydraulical standpoint. So how do we do that? So we developed a platform that is waiting to be deployed. Our platform, basically, we integrated the meteorological data, which we are going to install on the ground that will give us rainfall information. And real time, it's very important to mention that real time rainfall information, and as well as we also going to develop we are going to deploy a water level sensors. So that basically also will allow us basically to see the water level. And that obviously the water level has an impact on determining how many households are basically vulnerable. So this tool will help the Red Cross to know exactly at what place, at what time people will be vulnerable to the coming rain. So it will allow them basically to prepare on time. So the key for deploying such technology is basically ensuring that it can be contextualized in basically looking at Kinshasa context. So what we have planned is basically to organize some workshops, and basically I heard some speakers speaking about the capacity building. So that is part of the plan, and also seeing how our team can contribute in building a disaster management framework for the country which currently is not existent. So Thank you so much. I'm really looking forward for the discussion later.
Thank you so much for showing us the importance of data and this digital twinning and how that can help organizations to better prepare and have early warning, as well as be able to deploy faster in the areas that need it most. So very interesting. And now we're going to welcome Lourdes Sanchez. She'll be the last of our 4 speakers from United. Lourdes, please.
Hi, everyone. So my name is Lourdes Sanchez. I work at United, and I'm going to be talking about how we are actually developing products or supporting products, health products that have a high climate impact. So I'm going to start with a couple of words about United. So we are an organization that basically works in introducing and shaping markets for health products in low and middle income countries. We manage around $200 million of grants every year, and basically we support products that are effective, safe, affordable, and equitably accessible related to diseases like HIV, tuberculosis, malaria, women and children's health, and also more recently working as well on global health emergencies. At United, we strongly believe in the nexus between health and climate, and actually that's why this is part of our strategy. Our climate and health strategy aims to advance what we call climate smart health products and supply chains. So to do that, well, basically we have defined what this is through a framework. What does it mean exactly? So basically, we want to support products that, of course, first focus on health, so deliver a strong value for health, but also that bring significant benefits in terms of climate change adaptation and mitigation. So in terms of mitigation, so basically how to reduce the impact on climate change, we want to develop or to support products that are not harmful to climate. So basically translates into reducing the CO2, the carbon emissions of our products. And in terms of adaptation, we are supporting products that are resilient, meaning that they can withstand climate risk. Also, they're responsive to the evolving health needs that will come from worsening climate change. And finally, that they're adapted to local conditions. So this is the theory, how we're doing that exactly. So we're supporting investment in products that respond to these characteristics, health products that are climate smart, as we call them. And for now, we have identified 3 main type of products where we see like there's a high potential to tackle also climate change. So one of them is long-acting technologies. So basically, when you can have a treatment that you have, for example, a vaccine that lasts for multiple months instead of having an oral pill, we have seen that there are significant climate adaptation and mitigation benefits. Also, medicines related to HIV, we have seen that there's a significant potential for decarbonization, so reducing the CO2 emissions for that, so mostly mitigation there. And the example, I'm gonna dig a little bit more into that so that you see the way we operate, basically, is also the heat-stable solutions. So, well, why heat-stable? Why is this so relevant? So as you know, under almost every climate scenario, the projections are that global average temperatures are going to rise and actually affecting more disproportionately and severely countries, well, low and middle income countries. We know as well that several medicines, diagnostics, they are actually impacted by rising temperatures and humidity levels. Some of them need cold chains that are not, as it was shared before in some of the presentations, they are not necessarily working for all contexts, and that can only get worse under the climate change scenarios. So an example that we have some evidence about is basically the rapid diagnostic test for malaria. So from literature, we know from research and scientific papers, we know that actually they don't perform well if they are exposed to high temperatures or humidity levels. So actually, they can deliver false results. So imagine this is not a good thing. And this is a specific case of malaria, but this is not specific to that. There are also other medicines that we know they don't work well unless they are maintaining a cold chain. So taking this into account, what we want to do basically is to launch an investment to investigate the heat stability of life-saving health products. What we're going to do through that is first, we aim at generating evidence. So we want to know more what kind of products are most vulnerable, in which context, etc. Then we're going to map the solution. So what is already there that actually can help to drive this, to improve, let's say, the performance and efficacy under a climate change scenario. And finally, we're going to support financially some prototyping of products that can have high impact, both in the health perspective, but also in the climate one. So we don't do this alone. We normally consult with experts, etc. And actually, well, I'm going to leave it there because I know that there's going to be a special session on attach. But yeah, we're part of that group. And actually, we collaborate a lot to develop these kind of products. So thank you very much. If there are questions, happy to talk after later. Thanks.
So thank you very much for that. And we see the complexities in the whole chain of supply and in the research and in bringing products that we already have accessible that may be losing their relevance or their accuracy. And certainly if you get an RTD for malaria that's more performant, come and talk to us. We'll need it at Médecins Sans Frontières. So now we are going to go to the collaborative challenge round that I spoke to you about earlier. We'll have 3 presenters that will present what they're doing and the challenges that they have. We have Rafael Ruiz de Castañeda from the University of Geneva. We have Elena Villalobos-Prats from WHO, but really linked to the transformative action on climate change through the ATTACH program. And then from the Climate Accelerator, Geneva's own Alexander Robert. So I think I see 1 or 2 places. I'm not sure I see 3. 1, 2, 3. 3. So I will, the speakers will each go to their corner. I would encourage you then to divide up into 3, and we'll give you 15 minutes for each presentation and question and answers. I also would draw your attention back to the code, which you'll see by this tree, which I guess is going to be around the room. So if you scan that code, then you're going to get into a little bit of a database that can help you put in your ideas. There's also a section for new things, and we'd like you really at the end of your 15 minutes to put down the commitment that you make. That's going to help us remember. It's also going to help the presenter know who to reach out to. And the idea is that we're going to start the collaboration today, but that collaboration will be ongoing. And that particular website will be open until the end of the month. So with that, let's get up, shake our legs, and get to work.